Have you ever left a doctor's office thinking, they say I'm fine, but I don't feel fine? Well, that disconnect can feel disheartening, discouraging, and even demoralizing. It's like you start to wonder, am I reading something wrong? Maybe I am fine, but it just feels off to me. I mean, the truth is, you know something doesn't feel right. And it's probably because the full picture isn't being seen. And that's what I want to unpack today. Hello and welcome. I'm Carol Covelli. I'm a licensed therapist supporting the emotional health and wellness of women in midlife. So when you hear that you're fine and feel like you're not, here are 5 ways to start reconnecting those dots so you can validate yourself and bring this information back to your current provider or a new provider. Let's get started. The first point is you can have completely normal lab work and still not feel right. So when a doctor says you're fine, it's typically because they're looking at results from a set of tests. Usually it's lab work or blood work, and they're looking at those results, and and the results are showing that your levels are within limits for whatever test that they're testing for. But that doesn't mean that something's not happening. That doesn't mean that what you're feeling isn't real. And the important takeaway is that there is more to take under advisement than just the blood work. The second point is there's an overlap between stress and hormones, especially during perimenopause. And what can happen is the dot that can be missed is that what you're feeling can typically be chalked up to stress, but what is happening is because your hormones are recalibrating, it's causing stress within your body and it's causing you to feel stress. So this is very real. And the dot to connect is that yes, your body is recalibrating and you want to keep that in mind. So when you're told it's just stress or it's just anxiety, realize or consider connecting that dot of, well, yes, it is stress and anxiety, but it's because my hormones are changing and recalibrating. The next dot to consider is that labs in a snippet don't capture a pattern. So you want to capture the patterns of your feelings, of your behavior, of the things that are affecting you. You want to keep track of not only symptoms, but when things unfold. Start paying attention to when things happen, when your cycle happens, when your anxiety spikes, when your stress feels more intense than it usually does, when you feel tired and fatigued more than you usually do, when you don't sleep as well as you usually do. Start tracking the patterns because that's another dot to connect to bring back to your provider or another provider. The next point is so important. It's to get into or ask for a conversation rather than being dismissed or rather than being told you're fine. Get into a conversation about some of these dots that you're connecting, some of these patterns that you're connecting beyond what's happening in the lab work. There are plenty of doctors that do take into consideration what's outside the labs, but if that's not what you're experiencing, you want to make your doctor aware that, okay, the labs are saying this, but this is what's happening with me. This is the pattern, this is the feelings, this is what I'm noticing, physically, this is what I'm noticing emotionally, this is what I'm noticing relationally. You deserve care that looks at the whole picture. And the last point, which is exceptionally important, is to shift from what's wrong with me to what's happening in my body. And this is a place that therapy can be helpful if you choose to go see a therapist. But to shift from that mindset of there's something wrong with me, I'm defective, I'm not good enough, to shift from those types of judgments about yourself to looking at it from the perspective of there's something happening with my body and I need to have it addressed. And it's not a measure of who I am as a person. And again, this is where therapy can be very helpful, because if a lot of your functioning is tied into your performance or to your how much load you carry, how much you get done, how independent you might be, if there's a lot of connections to the functioning of your body in terms of your self-worth, if you're noticing changes in your body like this, then you could start dipping into some of those negative beliefs about yourself. And again, this is where therapy can be helpful to look at those negative beliefs and to shift them, as well as shifting your perspective from making it a situation where you're judging yourself to looking at your body as, this is what's happening in my body and this is what I can get help with if I can find the right doctor, the right medical provider. If you'd like something that helps to track what you're experiencing, you can go into my description box and grab for free my menopause checklist. It's a checklist of symptoms and experiences and things that could be happening for you right now that you want to share with your doctor or share with your provider, to explain, to give a snapshot of what it is that's happening. And together with that is a list of questions you want to ask your provider. So if you are having trouble opening up that conversation from, I'm not fine, and then where do I go from here? I say I'm not fine. You can bring up in that conversation some of these questions that are attached to the checklist. And if this video resonated for you, please subscribe for more grounded conversations around anxiety, midlife, and emotional health and wellness. And again, if you did like this video, please like and share, and please comment if you have anything that you would like me to do a video on. I really appreciate any feedback. Thank you again. I look forward to seeing you in the next one.